I only caught the tail end of Senator Langford's comments, but I totally concur on PBMs. It's tough to find a spot or a place in the healthcare delivery system where there seems to be such uniform consensus of what might have been a good idea 10, 15 years ago in terms of managing the pharmacy benefits has turned into a beast of its own. And boy, oh boy, I think it could be a place where you put a huge bipartisan win on the table, and please count me in on any way I can help all involved in that. I'm sure I'm going to come to a topic that has been at least raised by this side of the aisle a number of times. I'm going to try to get a couple questions in and then make my normal shorty spiel on technology. I'm going to start with you, Dr. Conti. I've been traveling, as I go around the Commonwealth, an issue we always hear about is drug pricing. And, I have to say, when I first started in public policy, my background was a venture capitalist. I know you've got to take high risks to get rewards, and not every drug pans out. And for, some time at the front end of my career, I was not sure that drug price negotiation was the right angle. I thought we gave pharma lots and lots of bites at the apple, and I finally thought, this is, it is not fair that the American taxpayers pay for basically the R&D costs for drug companies for the whole world. And I think the IRA, which took that first step on those negotiations, and obviously there's a lot of places where there's not generics. Can you talk a little bit about this first round of negotiations, and will the overall system and will the Medicare recipients in Virginia see the benefits of that kind of a negotiation process?
Yes, thank you so much for the question. There are 9 million Americans that will benefit directly from negotiated prices in their first round. In my research, we find that another 5 million seniors will benefit from negotiated prices in the second round. The first round drugs are largely targeted to diabetes and heart disease. Therefore, we believe that once the prices come down, patients will get more access and better health will follow. The second round are different. They are largely targeting drugs in specialty classes, including cancer and other immunological conditions. And here again, those drugs haven't had the benefit of competition. There are limited rebates on those products. And therefore, when negotiation takes effect, seniors will benefit from lower prices. We will all benefit from lower prices. And indeed, even commercial insurers will benefit from lower prices, because once that price is set transparently, other plans will likely follow.
Yeah, I agree with that. And I also, one of the real life experiences that made me change my position from business guy Mark Warner, or even maybe Governor Mark Warner to Senator Mark Warner, I've got a daughter type 1 diabetic, and she's been almost literally we're over 20 years of that, and I've seen, luckily, my family's able to take care of this, but the cost of insulin go up dramatically, and if there was ever a case in point, insulin, which...
Mark, I think there's something wrong with your mic, so try speaking right into it. I want to hear this.
Rarely do you ask that you want to hear every word, every scintillating word. All right, I'm going to... the point is, I got a kid with diabetes. I live firsthand the 5-fold cost increase, 3-fold cost increase I saw just during the tenure of her illness. I think what we did in IRA and on bringing down insulin costs, last year I brought a 94-year-old young constituent to the State of the Union, Marguerite Bailey Young from Fredericksburg, Virginia. It was living proof. Her insulin cost had come down. And I do think, that was the point of the spear. I do hope these next rounds of negotiations will continue to show those kind of benefits. I applaud what we've done. I also, and my colleagues have heard this from me again, but there is no field that has had more promises of technology transformation than healthcare. And we're about to see whether it is in drugs, in procedures, in wearable and devices. We're about to see artificial intelligence totally transform healthcare technology use at another iteration. At some point, Mr. Chairman, we got to make sure that we hold some of these savings accountable, because unfortunately what we see is we bring in all these new procedures, bring in all these new devices. They all promise, yet overall healthcare costs go up. This is a thorny problem. One of the reasons I was a little bit late, I had Pecori's, the director of Pecori in. That's not their domain, but trying to make some data-based analysis is something that I think on a bipartisan basis, we would be better served if we had those tools. And I know as we get into our tax discussions next year, how we frame some of these debates before we get to rates, I want to keep pushing this notion of technology transformation in healthcare, how we actually recoup some of that.
Let me say here, I want to work